we wanted to recognize two very important people that have participated with us forever, since the beginning. And so Steve Markowitz has worked with us for a long time, and he's going to present the recognition. He's the professor and director of the Barry Commoner Center for Health and the Environment. So thank you, Steve, for.
So this award is going to be for Amy Manowitz. So let me tell you about Amy Manowitz. I first met Amy 40 years ago, and actually it was across the street. We were both at Sinai both working for the asbestos research legend, Dr. Irving Selikoff. We were in the basic science building. I was a resident in occupational medicine, and Amy was a research assistant. And you could tell then she was serious, she was focused, she was organized. She was really an excellent person. And we both then went off to other places. I stayed at Sinai for a while, but then eventually ended up at City University of New York as she did. But so fast forward, 1999, Claudia and David published the paper in Lancet in July. And at that time, we were running this national medical screening program for the nuclear weapons workers, the people who built our bombs over the decades. And they had been exposed to asbestos and beryllium and chromium and nickel, all lung carcinogens. And so when we read this, we said, we need to do this. This works. We need to do this. We had the population. We called Department of Energy. They actually authorized us to do the work, and they injected us with an additional $1 million so that we could begin lung cancer screening in the year 2000. So we were really only missing one piece, and that one piece is we needed a person to run the program. And that person, the light went off, and that person would be Amy Manowitz. So we invited her to come, and she's worked with us since April 2000. And look, I can tell you adjectives about Amy, but they don't mean perhaps as much as evidence. So let me give you the evidence of our program. We've screened 14,000 workers in the last 25 years, 65,000 scans, detected 240 lung cancers, 3/4 of which are early stage disease. And to give you a sense of what Amy's about, in the last 10 years, we have had 90% adherence rate. In other words, of people who remain eligible for screening since 2014 in our program, 9 out of 10 come back every year for the annual scan. So that's Amy's work. I mean, she's had a group that's worked with her. Okay, Leslie Ann Williams is here. Others, Amaka Anyokolowazi, Brett Siegel, Jen Morris, Jen Stuckey, the CT technician, John Lane, Dr. Al Miller, Dr. Jay Miller, et cetera. But Amy really has been the leader, totally organized, totally focused. Nothing falls between the cracks. And so I think I-ELCAP thinks it's just time to recognize Amy for this terrific work. So.
Amy, congratulations, and you really deserve it.
Oh, thank you so much. Oh, sure. Thank you so much. I can't tell you how much this award means to me. It's been an honor to work with you, Dr. Henschke, Dr. Yankelevich, and the rest of the I-ELCAP team over the last 25 years. And being a part of the mission to save lives through the early detection of lung cancer has been the most rewarding part of my career. When I first started working on lung cancer screening back in 2000, there was little acceptance of the value of low-dose CT scanning. Now, thanks in large part to I-ELCAP, we have national lung cancer screening guidelines, medical insurance coverage for those currently eligible. There's still a lot of work to be done and many continuing challenges ahead, but I'm glad to have contributed to the successes that have been achieved so far in addressing this important public health issue. I'm so grateful for this recognition, but none of what I accomplished could have been done without the pioneering work of I-ELCAP and without the expert guidance of Dr. Markowitz, the founder and director of my program, and the guidance of Dr. Albert Miller, the medical director. I also want to thank my lung cancer screening team at Queens College, particularly my two colleagues, Amaka Onyekeleweze and Brett Siegel, who have been with me for the majority of my 25 years working on this project. They've both been a tremendous support to me as we've screened and followed up on the 14,000 plus nuclear weapons plant workers that have come through our program. So thank you for the privilege of being a part of I-ELCAP and what we call the I-ELCAP family. I look forward to continuing to work with you and to continuing to save lives by screening for early lung cancer.
So every program needs an Amy. So you have to teach a lot of new places. So next we have Jim Mulshine. Jim is professor of medicine at Rusk University in Chicago and the former associate provost for research and the VP for research. He's a board member of I-ELCAP, the Lung Cancer Alliance, I-ELCAP, and I-ELCAP. So he's been there from the beginning.
Hi, great to be here. It is fitting at this 48th I-ELCAP, as we've kind of wandered through the process from 1999, when there was a suggestion that CT screening could reduce lung cancer mortality. And I-ELCAP kind of emerged in the wake of that, and many in this audience know much better than I about those activities and how this was accomplished and that process. Well, today I have the distinct honor of recognizing one of the people who was fundamental to this entire process at various stages along the way. And that is Sheila Ross. Now, if you put up with me for a couple of minutes, Sheila is quite a remarkable individual, as many of you already know. And she has been fundamental as they worked from the validation of the NLST, the review of the U.S. Preventive Services Task Force, the process of getting through national coverage decision with CMS. And I don't think anybody's going to argue with me that every step in that journey was just very hard. And it took the work of many, but the strategic impact of a few was transformational in allowing us to be on the cusp today of bringing this service to improve outcomes across the world. So as reported in the Capital Gazette, so I'm not revealing any HIPAA things, Sheila is a lung cancer survivor. Having been diagnosed in 1992, undergone extensive intervention at the time, unfortunately recurred in 2000, went through even more extensive treatment, multimodality treatment at the time, and learned about lung cancer and where it stood in the world in that time, and got quite exercised. And Sheila, at the time, was a pioneer in starting what we now call advocacy for lung cancer, because in 1992, there wasn't any lung cancer advocacy, just none. So she did this in a series of moves. She joined I-ELCAP, unsurprisingly, was the first advocacy organization for lung cancer that existed. They had a tough time, and she joined them, and it was an organization of very spirited, wonderful people led by Peggy McCarthy, but the thought of doing advocacy on the West Coast was just non-viable. Sheila led the transformation of I-ELCAP into the Lung Cancer Alliance. She hired Lori Fenton Ambrose to be their leader, and she then guided them through a series of things. The first advocacy that was expressed to Congress, to communicate to Congress that they could help with, was with Hal Rogers in Kentucky. When his chief of staff developed lung cancer, they were all amazed to find out how dire the situation was for lung cancer. And they proposed a $25 million award to help research for the early detection of lung cancer. Now, this is early. So that 25 million was very wisely invested in colon cancer screening. Well, Sheila wasn't happy with that outcome. So she gets together with the staffers from John Murtha's office, and they wind up again getting $25 million on an annual basis, the congressionally directed award process that became the first sustained support for research for lung cancer that existed. That's a long story as to what happened with that as well, but she continued in her efforts. And through Lung Cancer Alliance, working with Prevent Cancer Foundation, Bo, and others, there was a challenge when screening was being reviewed by the Center for Medicare and Medicare Services. The initial recommendation from the advisory committee was not to support a national coverage decision. So Sheila, Carolyn, Lori went to work. And within a very short period of time, days, they had a letter with 150 some odd legislators to the director of Health and Human Services, who was a little bit more responsive in those days, to not listen to that recommendation to immediately work on getting CMS support for this service. And it happened. Never happened before. I don't know if it's happened since, but it was a profound impact, because taking it from a research kind of finding to moving it to implementation through CMS funding was profoundly important step. So my time is brief. There's numerous other examples of which Sheila has been central to transformational catalytic things that have moved this along. And I think many of you probably have additional stories. But I think we have agreement that her contributions have been remarkable, have been singular. And at this 48th LCAP, to recognize how we got here, please join me in recognizing the profound contributions of this person, extraordinary person, in making sure this is going to be a service that is available to all.
I want to thank everyone for this, especially Claudia and David, my heroes. But I'm really kind of overwhelmed, at a loss for words in a way. But I'll try to keep this brief. There are many, many, many people who worked with me. We saw lung cancer as a political problem. And you all were doing the science, but we saw the politics, which were horrendous. And little by little, we were able to break down that barrier. But it's because of people like you. It was such a pleasure to meet. Everyone I met was just a fantastic person, but most especially Claudia. I mentioned last night, the first time I ever saw Claudia was in 2002, when she was testifying before the Ways and Means Committee of Congress about CT screening for lung cancer. And what she said made such perfect sense. That was my inspiration. That's where it started. And then meeting with Jim Mulshine at NIH, while he explained to me IEN, intraepithelial neoplasia. I got a lesson fast, but it's all of you who made this happen because of your work, your dedication, and I thank all of you for what you've done. You're literally taking the most lethal cancer, or the cause of the greatest mortality, and turned it into a survivable cancer. And you did it. It's your work. Congratulations to all of you. Thank you again. Thank you. And you were very instrumental and always there to support us through thick and thin.